Hello everyone, how are you all? It's been long since we went live, and I just want to start this live sessions again with a very special guest. And the guest that I have today is someone that you all look up to. We all look up to, and it is an inspiration to many of us around and around the world. So, without wasting time, I want to tell that today we have a guest, and her name is, I'll say, the Dr. Terry Wahls. Yes, we have Dr. Terry Wahls here today, joining us live here on our channel. And I'm just gonna send her everyone for joining us today. And you'll be joined by Dr. Terry Wahls.
Morning, how are you?
Hi, Doctor. I'm great. I'm great. It's so good to see you. Finally, how
Marvelous,
have you been
marvelous.
doing?
It's just so exciting to be talking to you, to let people know about our research, and to be inviting people to come join us. So thank you so much for having me.
Absolutely, absolutely. It's my honor to be here to, promote everything that you are doing. As I was giving her introduction, I said, I don't have to say who she is. She is the Dr. Terry Wahls, someone who is an inspiration to everyone, I can say, around the world. And now we can see you are busy with more research, more studies, and something which, the entire world will have an eye on. Everybody would wait for the result. Yes. So, like, I know that everybody knows you already and how your MS journey has been. Would you still like to
Oh,
take
sure.
just a minute to tell how your MS journey and fighting with MS started?
Symptoms began during medical school. That's literally 45 years ago. And I had episodes of electrical face pain at my temple coming down to my jaw that would be more frequent, more severe. I had an episode of dim vision then, and 7 years later. No clear diagnosis at that time. And then later, I had weakness in my left leg. That's when I was diagnosed with MS. I saw the best people, took the newest drugs. I went to the very best MS center here in the United States. And then I started taking mitoxantrone, then Tysabri, then I switched to another disease-modifying drug. And my physician said, now that I was in the progressive phase of the illness, functions once lost would not be coming back, which is why I was going to keep taking aggressive drug treatment. And that's when I realized, like, okay, am I really doing all that I can? I could still be reading. And so I started reading PubMed. I began experimenting on myself. I decided that mitochondria drove disability. So I would devise a supplement cocktail, which made me feel just a tiny bit better. So I was thrilled to take my supplements. I adopted the paleo diet. Yeah, I'm still declining, although it's somewhat slower. And then I have this really big aha. What if I redesigned my paleo diet based on all the supplements that I was taking? Magic began. That's when, and I was. And later, I was so weak I could not sit up. I had to have special bands that I wrapped around myself in my chairs to hold me up. I couldn't sit at a table to eat with my family. Fortunately, I've been mentally clear, so I was still able to staff patients for the residents. But that's when everything changed. I redesigned my paleo diet in a very specific way, and a year later, I'm able to do an 18.5-mile bike ride. Of course, that changes how I think about disease and health. It will change the way I practice medicine, and it will change the focus of my research. We've done 7 clinical trials. We're now recruiting for an 8th trial. And, it's just so exciting. Now, I see someone's complaining that they can't hear me. I'll turn up my as high as I can. I'll jump closer to my phone. Much more that I can do than that. So hopefully that will be helpful.
I can hear you quite well though. All right. So I can just say when we talk about power of determination, and that's what you had within you, and that's how you yourself wanted to treat yourself when nothing else or nobody else, was there to help you. Well, talking about your researches, doctor. So like we know that there's a research study comparing the effects of 3 diets. One is a modified.
Our new study, we're very excited. We're going to compare a ketogenic diet, the modified paleo diet, which is basically the Wahls diet, to usual diet. And the reason we have 3 diets in a comparison group is that to change the standard of care, I need to have a control group. And so our control diet is the person's usual diet. I know that people who agree to be in dietary intervention studies because they want to improve their diet. So the control groups always improve their diet. They eat a diet always much better than the standard American diet. We fully anticipate that all 3 groups will improve, and it's full for 2 years. So one of our hypotheses, and I'm actually really excited about this one, because you and I have MS. People with MS, our brain volumes are shrinking 3 times as fast as happens if you have healthy aging, which is probably why people with MS, the longer we have it, the greater the risk for cognitive decline and dementia. One of my hypotheses is that if you improve your diet, we can get you your rate of brain volume loss to match healthy aging. And I'm very hopeful that the 2 intervention groups will get to the healthy aging rate of brain volume loss. And I think it's quite possible that the control group will as well, because I know they're going to be improving their diet. And I will give the control group a monthly tip sheet on things that they could do to improve their diet. Show that will be the most profound thing of all, that because the DMTs don't slow brain volume loss. And they do a great job of stopping enhancing lesions. Very, very good at that. But we still end up in wheelchairs at 15 years now instead of 10. So that's progress. We still end up with greater rates of dementia. And I think is key to addressing those. And the fact that we're doing our study for over 2 years will let us begin to measure that question.
So yes, doctor. So we have seen that the diet has done wonders when it comes to MS or any illnesses. A proper diet, and that's what has happened in your case. I just want to know that when you're doing this research, why have you selected these particular 3 diets? Otherwise, there's so many other diets.
The research, when we've looked at all of the dietary intervention studies, the research is the strongest for the modified paleo diet in terms of the effect size. Our study is being funded by a private donor who also follows a ketogenic diet. And that donor's had a very significant favorable response to the olive oil-based ketogenic diet. And so our donor wanted us to compare the ketogenic diet and the paleo diet. And the donor understood that we needed a control. And so the donor was fine with a keto arm, the paleo diet arm. And they're the one funding the study. I said, okay, we can do those 3 diets for sure. And that's And in the end, it's the funding agency that determines, agrees with the study design. Study is launched, then we run the study, do the analyses, write the manuscript, and I'm thrilled that we have a grateful patient whose life that we transformed, who came back to me to say, I believe in what you're doing, Terry. I'd like to fund your research. What would it take to begin to change the standard of care? When I sat down and said, okay, it takes these kinds of really big studies that go on for a couple of years. And when we discussed, she and her family foundation came back to us and said, okay, we'd like to support this study.
Oh, that's wonderful. So, doctor, have you yourself, tried some like olive oil based ketogenic diet
Yes,
on
as
yourself?
a
Have
matter
you
of
tried
fact,
it and how did you feel?
I have, everyone knows I've done a paleo diet for many, many years, was very successful with that. Then over time, I switched over to a ketogenic diet. And then as I am watching the literature and the concerns about the risk of a keto diet accelerating heart disease, I made clear that my version of the keto diet leans into olive oil, which all of my cardiology colleagues, agree is a very heart healthy, a heart friendly approach. So instead of the standard ketogenic diet, which leans into butter, cream, and eggs, which make my specialists, very nervous about those foods accelerating heart disease. But when they realize that we're talking about increasing olive oil, their patients to increase to treat their heart disease. Now the concept of ketogenic diet is of heart disease. We've taken away that resistance by swapping out the butter, eggs, cream for olive oil.
Yes, 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 absolutely. That was a concern when it was actually people started taking it, using it, practicing it a lot initially. So, doctor, my other question to you is about this research again. So, are you still looking for patients to participate in your study? And what is the criteria for them to
We've
enter
got
into this
51
research?
people in. We want another 100. So we'd like to get 156 people into the study. I anticipate that we'll be recruiting for another 15 months. You need to have relapsing remitting multiple sclerosis, be between the ages of 18. You'll need to come to Iowa City for a baseline exam, a 3-month exam, a 24-month exam. We will do a discussion of the study via Zoom to understand what all the study is about and what you're getting yourself into, because 2 years is a long time. Then we schedule another call where we get informed consent and then begin the study activity. Then you will come in for the first visit, the 3-month visit, and the 24-month visit. We'll have a research MRI, so it's a much more powerful magnet. It's a 3 Tesla magnet. There's no gadolinium, no contrast, but because the magnet is so strong, we can see, is this an enhancing lesion? Isn't it an active lesion or not? And then we will repeat that at 24 months. We'll do measures of walking, measures of hand function, measures of working memory, and measures of vision. We'll have a bunch of surveys that look at quality of life, fatigue, anxiety levels, and depression levels. Quality of life. And we'll be measuring a variety of functions, and we'll be collecting some blood and some saliva, so we'll have some biomarkers, and we'll have images of the brain. So this will be one of the largest a disease course.
Okay. That sounds pretty exciting, and I also can see there's so many comments here, and people really want to participate in your study. I have a question here by Ina. She has written, "Can I volunteer? I'm in UK and have RRMS. So what about the people around the world? How can they participate?" Can't hear you,
Yeah,
doctor.
we do have people coming in from Canada. We've not had anyone else coming from
Okay.
outside of the United States, other than Canada. So probably is possible. I think people who are from Europe are going to be nervous about the ability to get to the country, and it's really going to be expensive for them because they have to come on 3/24. If you go to my lab site, Wahls.
Doctor, one second. I'm sorry. I'm getting this lot of comments here saying the line is really bad and they cannot hear. Your voice is breaking a lot. Yeah, could you please repeat? Everybody's asking.
Still can't hear.
Let's try. Guys, if you doctor is talking again, if it's okay, please let us know. If there's a problem, just message here again, please. Okay. Yes,
so,
doctor. Sorry.
People coming from Canada, we have a couple folks from Canada. I would not recommend my colleagues from the UK coming over. For those folks, I do survey-based only studies that we do in collaboration with your university.
I'm really sorry, but I'm getting comments again that I wanted to stay. I can't hear. Everybody's writing. We can hear you clearly, but not the doctor. Would you like to, probably join again?
Okay.
Yes, probably you can try that. Or you can move to the other room if possible. Maybe the internet connection is
I am closer to the Wi-Fi. We'll see if that helps.
Yeah. Please let us know if you're able to hear the doctor then. We are trying our best. This is a very interesting study that doctor is talking about, and I really don't want anybody to miss on it. Please let us know, everyone, in the comments. Is this better? Can you hear now?
So that sounds really good. So we also have some survey-based studies. If you go to wahls.lab.uiowa.edu, you'll see that we have some links to some survey-based studies. And so that would be a great option for those who cannot travel to Iowa City. And for those who have progressive MS, I encourage you to complete the screening survey because that way you'll be in our database. We will have a progressive MS study that we plan to launch in about a year. So that would be really very helpful.
Okay, so right now the studies that is going on is mainly for RRMS, and for progressive MS will be done later on, and just you can register and be on database of the doctor's website, and then you will come to know whatever progress is taking place. Perfect. So okay, so now I understand from you that the criteria is that a person should be having RRMS and the age should be between 18 to 70 years old. Absolutely, that's great. So, pardon? All right. Perfect. That is great information, and I say that you have one.
To see the screening where you complete a screen so we can begin to get your records, is go to terrywahls.com, RYWAHLS.com. Okay, they say they can't hear me. Tell you what, I will leave my...
Wahls.com. I have written the website, it's terrywalls.com. Okay. Can't, Doctor, I suggest if you can just join back again, probably once. I'll be here. I'll send an invite again. Hi everyone, thank you for joining. There's some network issue at Dr. Sen and she's trying to figure it out. She'll be joining us again here soon. So let me try inviting her again. I hope you all are doing good. Thank you everyone for joining. Okay. Yes, so here what doctor was telling today is that she is coming up with a study in which she's comparing three kinds of diet. One diet is a modified paleo diet, which is the elimination of gluten, dairy, and eggs. Then a time-restricted olive oil-based ketogenic diet, and the usual diet with information about the USDA dietary guidelines for Americans. So these are the three kinds of diets that the doctor will be doing research on. And so she's inviting patients to participate in her study. And yes, your criteria of being in this study is, hello, doctor.
Hey, how are you?
I hope, guys, please let us know if you can hear and the doctor's voice, if it's better now.
Okay, I'm back. So, where were we?
So I was just giving introduction about your research again to everybody, and I told them the eligibility, the criteria of participating. Now I want to understand one more thing for you, that if this research, has a success story, and do you think that this kind of research and diet, to say so, can ever be a replacement to the DMTs in future?
Well, will it someday? Perhaps. And I do know that we have some patients who have done extremely well, have adopted our diet and never started their disease-modifying drugs, and are thriving, doing well, jogging, swimming, biking, living rich and full lives. So yes, I think that's quite possible. However, we don't have any clinical research that has compared diet and lifestyle without drugs. We have a quasi-experimental study for people who newly diagnosed, declined drugs, wanted to do diet and lifestyle. We trained them, and we compared them to people who were taking drugs and getting standard of care. That data is being analyzed right now, and I will probably be able to present that at a research meeting this spring at the consortium of MS centers here in the United States. But since that was not a randomized trial, it is not going to give us any evidence for saying that diet and lifestyle alone is good enough. I think we're still a long ways away from being able to say that. However, I do know that for some folks, as they read the side effects, potential adverse effects from the disease-modifying drugs, that is more scary than the risk of progression for not taking drugs. And that's a very personal decision. I can appreciate the fear of the drugs and the concern about the adverse events, which are quite serious. And I can also appreciate the fear of becoming progressively disabled if you don't take drugs. And in your heart, you have to weigh out which fear is most troublesome to you. Early in my career, I did not want to risk becoming a burden to my family. So I made the decision to take drugs. And as I became more and more disabled, I took more and more aggressive drugs, and I became more and more ill. Um, and then as I was able to recover using diet and lifestyle, I went to my doctor and said, look, I want to get off these drugs. And with my physician's blessing, he weaned and took me off the disease-modifying drugs. And I've continued to remain off disease-modifying drugs, again, with my neurologist's blessings, because I've done very, very well. My MRIs have not shown any enhancing lesions. And, you know, I'm now jogging. So yeah, my neurologist is like, damn, girl, you are doing really, really great. And you keep looking younger every time you come in to see me. I know your hair's getting gray, but man, you are doing really well. And you're still doing push-ups. Like, you know, that's really pretty good.
So what has really helped you the most in your journey? Can I just, say, is it
Sure.
the whole sum of the combination of your lifestyle changes and the
No,
diet, or particularly one thing that you can give credit to?
so the first thing that I think was most critical was getting in touch with the reason why to do all this work. And that was thinking of my, at that time, very young children that I have, that I wanted them to know that I was doing everything that I could. And then now, in my healing journey, the next thing was, I was doing the paleo diet for many years. I was taking supplements for many years. I added electrical stimulation muscles. But what really turned things around was when I took that long list of supplements I was taking and I redesigned my diet to maximize those nutrients. That's when the magic happened. Now, yes, I still take a whole lot of supplements, and I can tell I feel better when I take my supplements than when I don't. I talk about the list of supplements in my book, the Wahls Protocol, and I've since designed a supplement line that I have listed at terrywahls.com to make it a little bit more convenient. So it's certainly a process. I see one of the comments is, you can't get physicians to bless the stopping of drugs. Yes, that's very rare. The standard of care is to stay on the drugs. Yeah, but keep in mind, you are the one who are giving consent to take the drugs or to take the infusions. So you can talk about that you want to be transitioned to the least toxic drugs with the fewest side effects. And then if you continue to do well, that you want to plan to transition off of the drugs. But understandably, if you're going to go down that route, I would urge you to have a plan to monitor your MRIs, monitor your clinical circumstances to know that you are doing well, that your brain is doing well, and you're not creating harm. And I talk about that in my book. I talk about that in our programs. And certainly we have many people have tremendous success transitioning to less toxic drugs and get off disease-modifying drug treatments.
So, doctor, with this, there's one question in my mind. Sometimes it's said that not all the like it said that not all the DMT suit everybody. Similarly, not all
Yes.
kinds of diets everyone. It's customizable. It has to be
Oh,
customized
absolutely.
as per your type. So,
You
in
know,
that case, and when sorry.
and that's one of the reasons in my book I have multiple levels to my diet. So I've got level 1, level 2, level 3. I have a elimination diet, so it really makes 4 variations. And in my clinical practice, I can tell that some people will do much, much better on a lower carbohydrate ketogenic diet, and some will do better on a higher carbohydrate diet. You really want to have a clinician that can work with you to help you identify which dietary pattern is best for you and what dietary pattern is best for your family. Because whatever diet you do as a family, you'll be much more successful. If I eat one way, and if everyone else in the family eats a different way, that's a setup for failure and struggle and family family struggles.
So I see that it mainly happens with women. That what they do is that, supposing if a woman has MS and she's the one who's taking care of the food and the diet of the entire family. So what she does is that usually she makes her food separately and the food for the family separately. So I understand this is a very difficult way to go ahead. Sometimes, yes, you are successful, for a few days, making two different meals for the family and yourself. But then eventually you will also start probably eating what the family is eating because your body cannot
Yes.
support you much to take so much of burden. And
Yeah,
then probably you'll have to give up on your diet. That's what usually happens.
that is exactly correct. And this is where sometimes we help people have some family therapy so they can have a conversation about how we can compromise so the family's getting their needs met, the patient's getting their needs met, and everyone feels loved and supported. That can be a complex process to work through in having a medical team that will support you in getting the right talk therapist to talk through those emotional challenging conversations makes all the difference in the world.
Absolutely. Dr. Mai, one question about to you is about depression. I can see that there are so many patients after COVID,
Oh,
especially. They're having
yes,
relapses, or sometimes even if they don't have relapses, their body has become weak after COVID, that they keep falling ill
to
multiple
depression.
times,
Yeah.
several times, and which depression sets in. They don't even know why they're crying, and they
Oh,
just
yeah,
cry or
absolutely.
something unknown. What do you think? How can someone help their depression in through
Well,
diet or through supplements, or which way?
so depression is a very, very common consequence of multiple sclerosis. It's often made worse if we get COVID. And so many of us we're going to have COVID, we're going to have COVID multiple times now. As the brain becomes more inflamed, there's a greater burden of depression. Now, the really good news is in every one of my clinical trials, and I'm now up to trial number 8, but in every one of our clinical trials, we also measure the effect of the interventions on mood. And anxiety symptoms decline, depression symptoms decline. So certainly improving your diet is profoundly helpful. I saw some comments talking about isolation. Isolation certainly accelerates depression. Loneliness accelerates depression. So finding ways to be connected via letters, phone calls, video calls, in-person visits are so important to our mental health.
Absolutely. Nowadays, it's a trend, to be in one room and just, be on a laptop or be on a mobile. And even though you're sitting with people, you want to be just on your gadgets, and you're actually, getting socially deprived this way, which will
Yeah.
actually lead to more and more depression. That's what is setting in. My other question to you, doctor, is again about the research. So, for example, if someone wants to participate in a research, does that person have to be off the DMT, or can he
Oh, no,
be on
no.
DMT in the research as
Yes.
well?
If you're on a disease-modifying drug treatment, we want you to stay on it. We don't want you to make changes. If your physician tells you that you need to make changes for whatever clinical reasons, of course, follow the direction of your physician. If your physician is treating you for other medical conditions, including depression or anxiety, follow your physician's guidance. We will want your physician to agree that you are suitable for any one of the three diets, the paleo diet, the ketogenic diet, usual diet. We are clear with the treating physician, a olive oil based ketogenic diet, that this is not a high saturated fat ketogenic diet. And so for the vast majority of individuals, there's not a contraindication to being on any of the three diets.
That's wonderful. So I can see, there's so many people watching us here today by knowing that they can be on their DMT, because yes, like you said, sometimes it's a fear. You don't want to leave a DMT, and still they can participate in a clinical trial. That is the best news.
Yeah.
Which is really nice. So, Doctor, my last question to you would be about um, your motivation. What keeps you motivated to do everything that you are doing for the MS community?
In 2007, my future was so clear to me. I was going to become bedridden, demented, probably have to live with ultimately intractable trigeminal neuralgia pain. And that was a terrible future. But instead, I found a way to get control of my MS. My trigeminal neuralgia is a thing of the past. I have plenty of energy. I am up walking around. In fact, I am now jogging. Yes, jogging. So I can jog 2 miles. It's really quite astounding. So what I want everyone to know that if I can recover from such profound disability, then there's hope for you as well. I got my life back. I want you to get your lives back too.
Absolutely. Thank you, Doctor. That is a reason why you are like a hero to everyone, not just MS, but people dealing with autoimmune or other diseases. Someone who has been on wheelchair, you know, try to help herself, and today what she is today is an inspiration to the entire world. That's what makes you different from the rest of the world, and that's why we all look up to you for everything. So
Now, mind you,
I believe for sure. Sorry.
In the beginning, when I was telling my story, people in the MS community condemned me. They said I was dangerous, that I was spreading misinformation, that I was creating false hope. And my response, and these were well-meaning physicians who care deeply for their patients. My response is, I try to be very careful to say, this is my story. This is the scientific rationale behind the experiments that I'm doing, the clinical trials that we're testing. Will this help others with progressive MS? Will it help others with relapsing remitting MS? And that people can decide, are vegetables dangerous? Is meditation dangerous? Is working with your physical therapist dangerous? And if you feel comfortable with those things, you could talk to your physician about improving your diet. You could talk to your physician about, could you give me a referral to learn a stress management technique? Could you give me a referral to work with a physical therapist or an occupational therapist to increase my exercise? And could you send me to a dietitian to help me eat better? And some patients are like, no, I want to see randomized double-blind trials. That's why I keep doing my trials. But we have millions of patients who said, you know what? I do want to improve my diet. I do want to learn to meditate. I do want to exercise. And we've been transforming the lives of millions around the globe. So
That's so beautiful. Actually, trust me, you have always been an inspiration to me. When I got diagnosed with MS, the first thing I saw was like, Dr. Terry Wahls, let me know. Let me see who she is. And can I follow what she's doing? And actually, I try to do a lot of the diet modifications myself, try to see what's suiting me, what's not suiting me. If I eat this, what happens to me? All those things and all the learnings which I have of MS today is, of course, by my experience, as well as, I mean, living with MS, as well as the greater part of it, I will say, is by looking at what you have done and how you have transformed your life. And I'll say that everybody here listening to this agrees with me here. So you have me for sure in the clinical trial.
All right.
And I'm sure all the people listening here will be there too.
Well, we have 100 slots left, and we'd love to get filled. So
99 now.
yeah, 99. So please tell your friends, get everyone to screen, so we could get our 100 folks in, and it will make all the difference, because if we're going to change the standard of care, we have to have these randomized controlled trials. People ask, can't I just pick the diet that I want? That study design is called quasi-experimental. It's a helpful study, but it won't change standard of care. So to change standard of care, we have to have randomized controlled trials. So people have to be willing to come in, let us go through the randomization procedure, then tell you that you're in diet 1, 2, or 3. You'll get supported if you're in the intervention arms with the dietitian and group support calls. If you're in the usual diet arm, you'll still get a monthly tip sheet from us on how to improve your diet. I expect all 3 arms will improve, and we're going to measure brain volume to see, can I get you back to healthy aging?
Absolutely. It's so great. So healthy aging then is equal to Dr. Terry Wahls.
Yeah, that's my goal. Because I want to live to 120. And I want to be able to pick berries and play soccer with the little people in my life. And I'm hoping that when I'm 120, I still have little people in my life that I will be enjoying. And I'm hoping that I'm still meeting with my postdocs and writing new study grants, new procedures, and giving inspiring lectures to medical students and physicians and patients all over the globe. Although by then, who knows? Maybe it'll be via hologram.
You never know. Maybe tomorrow, Dr. Terry Wahls, when she's 120 years old, and she will be telling all the grandkids, saying that, you know what, once upon a time there was MS.
Oh,
and I got changed the entire scenario. That's what we all are hoping for.
Lovely.
To see once upon a time.
Once upon a time, there used to be MS.
Yeah, absolutely. And we all are waiting to hear those words from you. And we all are here to support you in all the clinical trials or everything that you do. So thank you so much, Doctor. It was so lovely talking to you today. And everybody here, it's my personal request that go on to drterrywahls.com. I will be sharing the link of the website here, and log into the clinical trials, register there, and see. It might work wonders for you. I'm sure not might, it will. So let's do it together. Thank you, everyone. Thank you, Doctor, so much.
Thank you.
Have a good day, Doctor. Thank you so much.
All right. Bye-bye now.
Bye-bye. Thank you. Thank you, everyone. Thank you for joining. It was so lovely talking to Dr. Terry Wahls. She is amazing, isn't it? Not just an inspiration to everyone, but also a very kind and a wonderful person. Let's support her in her clinical trial, and it is a trial which is for all the RRMS patients right now. You can participate in it, and your age has to be 18 to 70 years old, having RRMS, and yes, you can be on your DMT, yet be a part of the clinical trial. So let's register and try to make our lives better. So thank you so much, everyone, and we'll be coming back again with more sessions. And if you want me to interview someone specifically, you can always send me a request. I have already interviewed Dr. Terry Walls earlier, and it was again your request to bring her back again, and here she was. So let me know what all can I do to help you guys and bring more our MS community more and more closer. Thank you so much. Have a great day or have a great evening wherever you are in the time zone. Thank you. Bye bye.